Hello, friends. Welcome to the Ancient Health Podcast, where East meets West. I'm your host, Dr. Chris Motley. Today, I have the Associate Medical Director at Amen Clinics, a worldwide known clinic known for helping people neurology, their brain with neuroinflammation. Dr. Eboni Cornish is here with me today. She's been all over the internet. I'm very pleased to have you here, and I'm thank you so much for coming and joining us.
Well, thank you for the invitation. I just appreciate it.
I know that we're going to have a good time on this conversation, and I really love the way that whenever I watch you on YouTube, Instagram, I want everybody out there to know that Dr. Eboni can actually take complicated problems and conditions and explain it very tactfully and very simply. And when I watch you in your conversation with your bedside manner, it's very it's just warming to see that in a doctor. So we can go into with the clinic and about brain inflammation. But first of all, people out there do want to know about you. They want to know who you are. So can you talk a little bit about yourself?
All right. So first of all, I'm a mom of triplets, right? They're 9.
What?
Yeah, that's how I have to kick it off. You got to know that before you get into all the juicy details. You got to get a background. But like you said, I associate medical director, but I really love brain inflammation. That's like my thing. I love helping people heal. I consider myself a healer. I'm so excited about the things that I do, like studying the brain, helping those that are suffering, because the patients who come to my office, they've seen like 5 or 6 doctors and they're frightened and they're scared and they don't understand these new diagnoses, Lyme disease, autism, autoimmune disease, depression, anxiety. They don't get it. And they're looking for someone to like give them hope and to more importantly, dig for the root cause. So basically, I'm a detective, I'm a mama, and I am a student because we always have to keep learning, especially in this field of longevity. It always changes.
It's always changing. I like the way that you talk about investigation and being a mother of triplets. I got to go there. You had triplets. How old are they?
They are 9 and they are a mess. Okay.
Wow. I have to say, like when, at nighttime feedings and such like that, like how was that? Like, I mean, that's 3 babies at the same time. I mean, you got used to seriously holding in each arm and such. And that's a task.
I mean, it's such a blessing. But look, I treat these complex illnesses. So I was built for this. They were unexpected babies. We thought we had 1, then we thought we had 2. And then my son showed up like in week 10. Oh no, week 12. And I was like, oh my God, I've got 3. So, my mentality is go hard or go home. Nothing's ever easy for me. I always do my all. So everyone always says, if anybody was going to have triplets, it was going to be you, Eboni. That was going to be your thing. And so when you ask how I did it, let me tell you, I made their baby food because, why go shop for all this baby food? And I wanted them to be healthy. I wanted to be organic. And I had no time to keep going to the store. I didn't have enough hands. So me and my husband had 1 in the front, 1 in the back, 1 on the side. And look, we propped them up. We had those bottles. I tried my best to breastfeed, couldn't last with 3 humans running around hungry. So we did our best. We propped them up. They had a feeding schedule. And now they're beautiful. They're smart kids. They're athletic. They're gifted. But they're still, have their issues when the brother picks on the sisters, right? They're human and they're kids. But we have been totally blessed. And I think it's just a testimonial to my life that you got to nothing's going to be easy, but there's such huge blessings and they keep me going. And they're probably going to watch this because they watch everything I do. And they might say, oh, Mom, you got a goofy smile. Like they said that on one of my interviews. I was like, oh, man, I got to watch that. And they ruined my self-esteem a lot. But that's what 9-year-olds are supposed to do, right? That just makes you better. So they're wonderful. And I'm saying hi to them because I know they'll probably listen one day.
No, it's so good. It's so good. And I think that when you said that it's a testament about how much fervor you put into not only your family, but I think that caretaking is in your blood. Like you can see it in your face, like you want to caretake and help people. So what got you that passion to caretake for people? Like what made you go into into medical school?
Well, I mean, my story isn't exotic. You have some guests who are like, oh, all my life. No, I actually started in medicine because I was in high school. And a friend of mine was like, you can make $100 for the summer if you go to this camp and learn about medicine. And I was like, sweet, I went and I got this program. Brown decided to accept me from high school to med school. I didn't have to worry about testing. I was already in med school from day one. And then it was awesome. And so then after I
Wow.
graduated, I did family practice. I ended up
Hmm.
coming to DC. And then I was going to work for Kaiser. I was all set and doing family practice. I went on Craigslist, Chris, looking for a couch. And the job classified. Now, this is before Craigslist was the Craigslist. So the job opportunity said for doctors who think outside of the box. And I was like, you know what? Let me try that. I had no idea what I was getting myself into. So then I started at a practice that specialized in tick-borne diseases, Lyme disease and co-infections. I'm from
Yeah.
Detroit. I never heard of chronic Lyme. I never heard of real Lyme disease in med school. We didn't learn. That was like one
Uh-huh.
page of like 15 minutes of teaching. And then I started seeing all these chronic patients who were just suffering. And my heart went
Yeah.
out to them because I was like, wow, I have a reason to be here. I'm not
Yes.
sitting there
Yes.
just sitting down writing prescriptions. I'm really listening and trying to help them. And I mean that. And so, yes, it was hard, the last 15 years being in this kind of field, being in complex chronic illnesses, longevity. It's not easy, but
Yeah.
it's
It's like
what God wants me to do. And, I'm very grateful every day to do it.
that is a good. So you saw the suffering in individuals, and you knew that there was a need. When you started seeing all these people, and you can see it in your heart that you have joy doing this, what are some of the things like when you see somebody in Detroit, right, that had Lyme disease? Because you don't hear a lot about that up in that area, Michigan. And because there's many times there's physicians that I've heard say, "Oh, there's no Lyme disease in this area." But what were some of the signs and symptoms? I know we do testing because people out there are going to listen and go, "Well, what does Lyme disease produce? What kind of symptoms would you automatically say if you have these? You may want to get it checked."
Let me tell you something. Lyme disease is the great imitator, okay? The
Oh, I'm writing it down.
symptoms can be so nebulous. You can have this unrelenting fatigue that you can't quite explain, or you can have the traditional joint pains, aches. You can have fibromyalgia. You can have that fog that might start as simple as I can't remember where I put my keys, to as debilitating at being down this, dementia
Mm.
diagnoses. You can have psychiatric manifestations. And that's what I think I see a lot of, because patients can present with tick-borne diseases and their primary symptom is anxiety, depression, or psychoses that doesn't get
Mm.
better with psychiatric manifestations. And when I say the great imitator, people come to my office may have been misdiagnosed when it gets to the late stage with Parkinsonian features or multiple sclerosis or autoimmune disease, and they don't understand why. And that's why I always teach, like, look, you can get these underlying infections no matter where you live,
Mm.
right? You don't
Mm.
have to live in a
Yes.
rural environment. And if you have symptoms, it's usually that you can't explain, and these doctors
Mm.
keep kicking you out of different offices, then you got to think about underlying vector-borne diseases. It's so easy to put it on your list.
Definitely. It's like whenever you think that those chronic indicators can create such bad issues within and throughout the body. One of the videos that you've been in, and I've seen that within the Aiming Clinic, you talk about how, like Lyme in itself, like this little bacteria can go in and you say a great imitator, but you have also talked about how it can like burrow in and it can injure the tissues and cause lots of severe issues. Is that, can you describe a little bit about that? Because some people would think like the little bacteria can do that much damage.
Yes. So what happens, and when we say Lyme disease, guys, we're not just talking about one bug, right? We're not talking about going to your
Mm.
doctor's office thinking you have the traditional rash, because less than 50% of patients have a tick bite and a rash. So we have to put that out there. And not only
Mm.
that, the standard test by LabCorp request can miss a lot of cases. So by the time I see patients who have been misdiagnosed, they have this underlying brain inflammatory process going, meaning these bugs are so smart that they can cross the blood brain barrier.
Wow.
And that's
Wow.
when you
Wow.
start getting those neurological changes, that numbness, tingling, even that ear ringing, those visual changes, those mood
Mm.
changes,
Mm.
headaches, brain fog, because it can become very resistant over time. And because it's such, an epidemic, people are learning more about it in the media with celebrities, but there are people who have been struggling every day because they can't get those answers because their doctors don't take the time to listen or do the testing. And because it causes inflammation,
Hmm.
it can affect every area of the body, even those
Yes,
that we once thought were protected, like the brain and even the eyes. So it's so smart. These are some smart organisms, and they
definitely
can be
are.
tricky. Yeah.
And when you find that something like that could cross the blood brain barrier and affect neurological tissues, so you're starting to see the rise of like MS,
Yeah.
Parkinson's. Yeah, has it been an eye-opening experience for people who learn that they have it, that they're not necessarily dealing with MS or Parkinson's? What is the look on their face when you as a doctor say, okay, you have MS type symptoms, but you really have a Lyme infection or a co-infection? What do they respond to? Because they most of the culture would not say that it's a disease like an infection causing these things. We just think it's something that comes by osmosis. But what are the responses you get?
Oh my God, that question just made my heart flutter because I'll never forget. I had my first patient, this was like 8 years ago, and she
Mm.
came to my office and she had been diagnosed with MS, but she did not have any neurological symptoms on medical imaging by her neurologist. They just said because she had movement disorders, that was it. And then we did a Lyme test for her, and she showed up positive,
Wow.
and we got
Wow.
her started on a really aggressive regimen because it crossed the blood brain barrier and it compromised her immune system.
Mm.
And her symptoms got so much better. And in her
Mm.
case, it was herbals and antibiotics. And I just remember, and this is a true story, and I get choked up about stuff.
Mm-hmm.
Her husband coming to her appointment, like, I got my wife back.
Oh,
Thank you. And she had been down this road. She was on so many medications. She wasn't getting anywhere. And it was like treating that underlying cause. And that's what I find with patients. It's so rewarding because
yeah.
I treat all kind of diseases, right? Lyme is just one of them. But when you find that root cause and they know they're not crazy and they know that there are things that they can do to get better, that's why I'm in this field. That's
Yeah.
what makes my heart happy is that I can give hope. And it's so rewarding when I'm blessed to see a patient get that diagnosis and that treatment based on the real problem when they've been
Oh,
neglected for so long. I mean, it's just,
that's
that's what I love about this.
I can tell because I individuals out there that listen to this, I believe a lot of our listeners are, I really believe they have good intuitive natures and people out there under like empathic nature. I can tell when I talk to you, like you're a person that sees really the big picture. Like you can see the whole picture. I'm saying Chinese diagnosis, I can, you, after a while you look at somebody and go, oh, you can see plans and you can probably see somebody's where they're going to end up. All I'm saying is when you do that, when somebody comes in, what is like the first steps? Like, so you did get the diagnosis. People are listening. They're like, I got neural inflammation. I've got the brain fog. I've got tinnitus. I've got vision issues. Do you guys put them through what kind of testing, like MRI, CT scans, or is it different for everybody?
So what we do is we do brain imaging called SPECT scan. And what that
Hmm.
is a 3D image of your brain where we can look and we can tell what areas of your brain are not working well, what areas of the brain are working too hard, and if there is an inflammatory pattern. We can
Oh,
also know what questions to ask. So we like, oh, do you have problems with trauma? That's what I see a lot. A lot of times I'll
mm,
see this trauma pattern on SPECT skin where the front of their brain, the frontal lobe, something called the anterior cingulate, the sides of their brain are affected where you have what's called the basal ganglia that keeps you in fight or flight. And then the
mm,
deep limbic system where you can't relax. So it's like a diamond pattern. And it's like
mm.
what the Amy clinics have coined like a PTSD pattern. When a
Oh,
pattern is like that, the brain doesn't feel safe to heal. So those are those patients where if they look like that, or they have a pattern that I see a lot with my patients where their brain is on fire, like it's overstimulated. It's a ring of
Mm.
fire. Like areas are too active. And you know what? I gotta calm that brain down. So those are things I look for. So before I met you, 9 times
Mm.
out of 10, I've looked at the most intimate part of your body, which is your brain. That's giving me a little bit of an understanding of what's going to walk into my door. But I don't just start there because you got to make common sense. As my grandmother used to say, rest her soul, you got to be basic. So we're dealing with complex chronic illnesses,
Mhm.
but we're also dealing with immune function dysregularity and
Mm. Mm.
inflammation. So if I tell a patient, look, if you're not sleeping and I'm not looking at your hormones and I'm not treating your gut and your brain, guess what? What we're doing is not going to work. I don't care what diagnoses I give you because patients always laugh because I'll get all these diagnoses because I treat mold and Lyme and heavy metals and autoimmune disease. And I say, I have all the things here. You got a
Mhm.
long list of things, but how well are the basics? Because I got to stabilize the foundation if I want some changes. And it can be as little as just doing a barter system, like a patient who comes in with Lyme disease, their diet isn't the best. Okay, you're not going to change that person overnight. You have a
Mm.
barter system. You take something off your list that's toxic, right? Because that means you don't love your brain. And I'll take off one recommendation or supplement that you need. And we work that way because you see, you got to keep it real with these patients. They come
Yeah,
in and they've been suffering for a long time. And when you don't feel well, sometimes you don't treat yourself well. So
that's
I'm
right.
always starting with the center because I think these complex illnesses take a physical and a spiritual journey on so many patients that walk through my door. I'm doing a
Mhm.
disservice if I just jump and start treating problems.
That's right. And when you talk about the spiritual journey for a patient, can you describe that? Like like, do you feel like spiritually they feel sick as well? Like they just don't feel right in their spirit, and they need healing in that way too.
I think that's absolutely right because you have to think about it. If you've been dismissed by your
Mm-hmm.
family, and you've been
Mm. Mm.
neglected by your doctors, and you might look completely healthy to a general person, but you know you're struggling internally, you may ask, why me? And you
Mm.
may get discouraged. And it might be really frustrating for you, which is
Mm.
common when you have complex chronic illness. Because when you're seeking help and you're seeking love and you're seeking support and you don't get that, that is what I'm talking about when I'm looking and finding those neuropsychiatric symptoms or those neurological limbic systems or that brain that won't shut off. That's from
Mm.
years of the trauma of being unwell and being misdiagnosed and suffering. So I always tell my patients, I'm like, look, this is going to be a physical journey. It's going to be an emotional journey because there's always ups and downs when you're treating complex chronic illnesses, but don't lose faith in this process and know that you have providers who are going to hold your hand through it. And once you have that hope,
Mm-hmm.
no matter how long it takes, because no one has a magic wand, right? We're dealing with
Mm-hmm.
complex chronic illnesses. But once you have that hope and that knowing someone's praying for you, knowing
Mm.
someone understands what's going on with you, it feels so much better. It gives you that drive in some patients and that motivation because when they walk through my door, I'm telling you, every day I see the crying patient, the scared mother, the scared husband, the scared wife. And that's because by the time they're here, they're like, I'm in functional medicine because traditional medicine has failed me. I'm
Yes.
desperate. And so that's when you have to take those baby steps because if you don't get the spirit right, you don't get the body right. And I tell them to practice
Wow.
gratitude,
Wow.
to practice patience and be patient with your doctors because we're still learning and
Mm-hmm.
be patient and forgive yourself when you can't be that perfect person going through treatment because it's challenging. But keep that faith and know that I always end my sayings with the best is yet to come. Because the body is brilliant and it can heal.
Oh my goodness. That's mic drop right there, Doc. That was amazing. I'm
Boom!
serious. Totally. Because it keeps your faith in this, in a system where you think that, like, your bedside manner, the way you listen to individuals, like you're actually looking at their spirit. And have you had times where a patient comes in and they said, everybody says I'm crazy, and then you've reaffirmed them and they just look like they're full of hope?
Every day. Every day. And
Wow.
that's why, let me tell you, because people may think, okay, Amen Clinic is psychiatry. We are
Yeah.
brain health, right? I'm a
You're doing brain
functional
health.
medicine doctor. So I'm understanding the root cause. Mental health is brain health. And you have to use those terms together because no one wakes up and says, hey, let's be sad today. Let's be anxious. Let's feel like this.
Oh,
No one wants that, right? No
yeah.
one wants to feel that way. And so when they come to my door, it's words I don't use. I say, use the word crazy. That's a curse word. You can't use that here. We have to find other ways to shift our thoughts because we have a long way to go. This is
Yes.
not going to be easy because once you're dealing with things that affect your brain, it's
Hmm.
not overnight. And so you give them that patience and that hope and, that belief that
Hmm.
they know their doctor has their back and is going to
Yes.
try to work through it, and lights go off. Even in some of my harder cases, and especially the kids and that get dragged in, they're dragged in by their parents, they don't want to be there. And it's like, okay, let's try. Let's try one thing at a time. I'm going to meet you where
Hmm.
you are. But I know my prayer for you is to find the root cause of this inflammation and then do the digging and treat the real problems so that you can
Yes.
start that healing journey because the body can become better.
Oh, Doc, this is so good. Okay, so we're gonna have a lot of good clips from this podcast. To make it so easy. Um, two things I love the way you said about functional medicine. So there's some people. Two questions, but one is some people may not even know what functional medicine is to find the root cause. And number two, you hit nail on the head when parents, you say, drag their kids in because they know something may be up with their son or daughter because maybe their mood changes, like depression, anxiety. I know that you guys have been very sought after because individuals like Justin Bieber had depression and anxiety and such. Number one, can you give us a brief description of what functional medicine is? And number two, can you give hope to those individuals out there like depression could be associated with neuroinflammation?
First of all, I want everyone listening, if you don't know what functional medicine is, it's okay because I didn't. All right. Functional medicine is understanding the root cause. So we tie in all the systems, right? So if you come
Mm,
in with a complaint, I'm not going to say, okay, here's your med for that problem. I'm going to be looking at everything that is associated with healing. And that
yeah.
means testing your hormones, doing your gut work, trying to find out root causes like, are you ill because of infections or toxins
Mm,
like mold or heavy metals or just pesticides? And all the list goes on because we're in a toxic society. And
mm,
then I treat what is going on down in the root. And a lot of patients always tell me, oh, or even my family, functional medicine is for the rich. No, the way your body functions is important for everyone because
mm,
you can even make functional medicine changes that are free. If it's as easy as trying to fix your sleep cycle, changing and getting the right foods, maybe going to that, frozen section if they can't afford the fresh veggies, or making, quick 5-minute meals that are free of toxic foods, but are
mhm,
culturally sensitive to your needs. And, just making the going out and even getting sunlight first thing in the morning and getting your
mm,
heart rate going. So just understanding the core of the human body because there are
mm,
so many things that tilt us over the edge and can make one person completely healthy and someone else really suffer for years from these chronic complex conditions. So it's
Mhm.
all about that detective work, finding that root cause. And it is what you need to do, because when I first started in family practice, let me tell you something. I was a dispensary. Hey, you got diabetes? Here you go. Take your med. Get out of here. It's 10 minutes. I got to go to the next one. Get you in. It's a
Mm.
factory. But I found myself not feeling fulfilled because I
Mhm.
felt like medicine was deeper than that, right? And you
Yeah.
start reading the books and doing the studying, and you start learning about the plants, learning about the herbs, and telling people you love about that and seeing how people change. So that's really what it is. It's connecting all the dots of a person's body to help them
Mm.
heal and recover for whatever it is. But you won't really know the problem until you get digging into that root cause and asking the right questions. That's what I love
Yeah.
about what it is I do.
Oh my goodness. I think that when you can take the signals of all the pieces, like I can see as you investigate, so you're taking a piece from this part of this blood work or taking this imaging and you put it all together and you start to make this story for that person, and then you can correlate it with that person to see if it matches up with their symptomatology, which I think is beautiful. And so I was watching one of your videos and you were talking about people who had chronic depression, and you're talking about how much like they suffer. And I love the way you say give them faith, and doing the steps of investigating, you've shown that you could take all those pieces and put it together and relieve their depression and help them get out of it. And seeing these success stories, could you touch on that, like the like being an investigator, knowing that you can help people with depression as it relates to this infections or neuroinflammation, because that's what some people think. Oh, it's psychology. I'm like, no, it's everything. It's functional. It's all these pieces. Can you touch a bit on depression and mood?
Because it's really not all in your head. My first patient that I
Mm,
collaborated on in 2010 with Avon Clinics, she was the former medical director's daughter. She was
mm,
completely healthy, was rode horses, had all A's in college, and then started getting bipolar and severe depression. She had tried all these SSRIs and all these sleeping aids, and she wasn't getting better. And then we were able to find out that she, in fact, had tick-borne disease. She had Lyme disease. And when we treated her Lyme disease, her symptoms got so much better. And that's
wow.
what built that partnership with me in Amen Clinic and functional psychiatry, because we know it's not all in your head. And
Yes.
sometimes mental health symptoms can be
Mm,
the only symptom someone has as it relates to Lyme disease. They may just have that anxiety and depression, and they don't have those things you think about, those stereotypical joint pain, muscle aches, headaches. They might just present with anxiety or depression that's not going away. And
mm,
that's why you do that digging, because I tell you, this is a fact. You cannot treat tick-borne diseases with an antidepressant or antipsychotic. You are not going to get better unless you treat those underlying infections and those complex chronic illnesses that are impacting your mood. And I remind patients that all the time.
that is fantastic because um, I had a patient just today, doc, and she looked at me and she said that I'm having anxiety that comes out of the blue. That is just coming from somewhere, and she doesn't know. She goes, "I was feeling a little better." I want to touch a bit about mold and other infections because I watched another video that you talked about parasites. It was so good, but she was saying, she said that I get this anxiety, and you could almost see that internally she thought it was something wrong with her. She was like, "Oh, it's me." I said, "You know, in Chinese medicine, well, when your small intestine is very, very sick, it'll make you lose clarity of life. It'll make you feel like can't be decisive." And the relief in her eyes, knowing that yes, there's times when there could be some psychological, inhibitions or something of that sort. But when you can tell, like there are infections that could create this kind of change in your mind in your body. So whenever you start seeing these patterns come up, you start cleaning them out. People do ask a lot, like you said, with foods, and you talk about these things coming up to surface like mold, fungus, parasites. These are mood changers as well. Do you find that a lot? Because I saw a great video you talked about into amoeba. Like you talked about that. It's things I love to talk about. I know as weird as it may sound, but can you touch on parasites and mold and fungus and such?
Oh my God. The way you break it down, Chris, I say, look, bacteria and viruses, they need our cells to replicate. Okay. That's how they live. They need us. A parasite and yeast, they don't. You know, you can make
Ooh.
groceries. Parasites live on their own. They have their own mind, right?
Wow.
So, who do you think is going to be the most harmful? The ones that's dependent on your cells or the ones that live outside the human host? Of course, it's the ones that live
Yeah.
outside the human host because they live
Wow.
on their own. And if patients aren't being tested for parasites, you're really missing the mark. The one parasite that I'm in love with, I can tell you how much I love it because it really, when you treat it, I mean, it is remarkable. It's toxoplasmosis gondii. Now, that one by the CDC is the most commonly misdiagnosed infection ever in our country
Really?
because you can get it from cats, cat litter boxes. So I'm not a big fan of cats because they give toxoplasmosis and Bartonella, tick-borne infection. So sorry, guys. And you can get it from pork. And I'll
Wow.
never forget this lady, they called her the crazy cat lady. She came, she was diagnosed with schizophrenia. And then I'm like, asking her about her, like, okay, her family's giving up on her. I said, do you have pets? And she's like, oh, yeah, I got like 7 cats. And I was like, oh, okay. So we tested her for toxoplasmosis. We treated her with Daraprim and other anti-parasitic. We added herbals.
Yep.
She wasn't psychotic. She had a parasite. And these
Wow.
parasites, they can cause, just like with tick-borne disease, they're fun. They're interesting. They can enter into your cells, right? Cause
Yep.
your cells to look foreign. And then your immune system's like, hey, there's something out there that's foreign, but it's really you. So then your immune system starts fighting you. So you get this like an autoimmune process that happens. And it can be neurologic, it can be through the body. But I'm telling you, parasites, look, I had to swallow. I'm telling you, parasites are missed daily
Hmm.
because not all of them are bad. Chris, we know that.
Yeah.
We need parasites. Our microbiome is 300 trillion organisms. So we live with them every day. But
Hmm.
it's when we get those imbalances in our gut, that dysbiosis, where those parasites start to become, some of them, pathogenic or bad for us. And they
Yes.
can cause significant, not just gut issues, because always people think, oh, parasite gut. No, we're talking about neurological parasites and getting on
Wow.
a good guided plan, because that's another thing. Patients come to our office, oh, I did a parasite cleanse. Well, what did you use? And how did you use it? And then a
Yes.
doctor help you through it, because parasites have a great life cycle. They're challenging. They reproduce, they lay eggs, and then they keep
Mhm.
it going. So it's really, you have to look at other things that come with it. And you mentioned yeast and mold. I'm going to
Mhm.
tell you right now, because parasites can develop what we call biofilm, which is like a resistant niche that they surround themselves by. It can be
Mhm.
made of metals or toxins, and it makes them more resilient because it allows for them to hide from your immune system.
Mm.
It comes along a lot of times with yeast. So whenever I'm treating parasites, I'm always treating yeast at the same time because they're like besties. They come and they infect each other and they infect you and they come together. It's like a partnership. So you have to make sure you're covering from both. And then you layer on top of that, let's get even worse, you got the environment. All right. So
Yeah.
you have these patients who then can be in this mold mycotoxin environment, and they can't clear those organisms out of their body. So now you have a whole nother organism that's causing symptoms like mood disorders, schizophrenia, dementia. They have so much literature out there, both with toxoplasmosis and schizophrenia, and then with mycotoxins and depression, anxiety, and even dementia from living in these water damaged buildings. So like we said, we call it the things, right? It's multiple different things that can contribute to overall health imbalances. But if you stay organized, you can get rid of it. Because guess what? None of this is new. All of these things have been around forever. So
Yeah.
now we ask ourselves, well, why am I now becoming more susceptible to illness? And that has a lot to do with things you talk about, like toxicity, like our
Yeah.
gut being destroyed. So that's when it goes back to that foundation. You can have a lot of these diagnoses, but
Mhm.
what is it that makes you so special that these disorders and these organisms that someone sitting next to you might be able to tolerate, you can't? And that's
Yes.
what's so beautiful about making an individually tailored approach, not only to testing, but also understanding what makes that person unique.
Wow. And that is so well said, Doc. When you know that somebody's tailored, you're tailoring it to them. I'm intrigued. That's why I'm writing all these notes down, everyone. When you do a test, some people would say, okay, if I suspect this, I want something individually tailored to me. They can contact you. They can, get into a program. What are like the first tests? Maybe people need to like just real quick, like research, where would you get the lab testing at your office? Is there labs out there? Because some people, like you said, will think a parasite in our culture, in Western medicine, Eastern medicine, sometimes they'll say, "Oh, parasites do not exist in this area. Parasites are not in America," and that's pretty far from the truth. So, are there like tests you could say, "Hey, if you suspect it, of course, have the guidance of your primary care doctor," but is there like places they could research to get a lab test to do it?
Yeah, and that's a great question because there's no perfect labs. I tend to prefer in my practice, I use everything. I use a lot of what's called vibrant labs. They're more
Yeah.
diagnostic cash play labs that really give me a good assessment of the microbiome.
Mm-hmm.
And that's my preference. I find a lot of great results with them. And then it gives me a way to start doing a guided approach. Some people might use other diagnostic companies like Doctors Data and Genova. But you know what? For the microbiome, because like we said, it's so many organisms, you may not catch everything because we just don't know how to test for everything. Right.
Yeah.
So
Yes.
looking at some of those gut tests, you get a sense of leaky gut or inflammatory gut. But then when you're thinking of parasites, those people out there, there's a simple blood marker. Something, listen, it's called eosinophils. You'll
Oh.
see that in your blood work. You can see high levels of it on your stool study. It's called eosinophil protein X. And those give you clues that there's possibly a parasitic component because I can't tell you how many of my patients have visual parasites in their stool. Their GI doctor's giving them a stool test at the standard lab and nothing's come up and they're kicked out, but they're still suffering from these pathogenic organisms that are now disseminated, and some of them can cross into the brain if we don't catch it. So you have to use your resources wisely. Like I said, it's unfortunate because a lot of the best tests may not be covered by insurance, but may be reimbursed. But then you can look at blood work and get some clues, like if their white blood cell count is high. And that's
Mm-hmm.
a test, everybody, called a CBC. That's where you can find those clues. And then if you do a stool test, you're looking for that same thing, that high level of eosinophils. A lot of times that can be just something to put parasites on your radar. They can also be high in allergies, but I tend to find it because I deal with a lot of immunocompromised patients that
Mm-hmm.
gives me a clue of parasites. And then it's just a symptom complex.
Mm-hmm.
Parasites, yes, you can have those gut symptoms that we traditionally think of. From toxic foods, drinking water, traveling, even like we talked about with cats, but also those neurological symptoms. So those are my patients. I'll never forget it. When I first started, before I understood functional medicine, even when I was treating tick-borne diseases, it was like Lyme, compromise your immune system, treat that only. And then patients, I'm like, wait a minute, there's parasitic involvement here. So I
Yes.
need to not ignore that entomoeba or those gut parasites, because that can prolong their illness because they compromise their immune system. So I definitely recommend people, if you're doing parasitic cleanses, that you do
Mhm.
them under the guides of a physician, but they are needed because parasites, we all have them. If we eat
Mm.
food, you probably got a parasite in your microbiome of some sort. But
It's
you
really old.
don't want them, you don't want the bad ones. You don't want the pathogenic organisms to take control.
That's great, Doc, because I never even thought about that eosinophils markers and having that, because most people would take their blood work and they would say, well, everything looks pretty good. Everything is in some ways balanced. But knowing this, though, I think people out there can look at it now and say, hey, this could be a possibility. And have you ever? I love some of the way your banter. I love it on mine, and you've talked about symptomatology, and I'm not just harping on parasites, but you've talked about when people come in, you look for signs and symptoms like itchy bottom or any type of sugar cravings, things that would feed them. And I know that most people would say, yes, we need to eat better. But are there like just the main foods you say that feeds them, and then they'll get somebody could eat a certain type of food and they get like reactions? Are there like a list you tell your patient? I know everybody's bio individual, but you go, okay, if you eat this, you possibly have parasites. Is there any type of list like that?
Yeah, so, one thing I always ask is the sugar cravings, right?
Yeah.
Because that's usually a sign. I say, okay, look, it's not you, it's your microbiome. It's most
Mm.
likely yeast overgrowth or parasitic overgrowth, and especially with yeast, because yeast is a beast. And all you're
Oh,
doing
yes.
is you're treating those resistant microbes by giving them sugar. But then you have to always be careful with patients. And we don't talk a lot about what you should eat because it's so great. My perfect patient would be gluten free, sugar free, seed oil free, corn free. But I have to make it sensitive to their cultural diets and also to their finances and just their needs. So I'm not going to tell you, if you sit there and you tell me, because I always ask what you're eating. I'm eating, fast food every day and sugar, and I just can't control myself. Well, we try alternatives because a lot of people who have sugar cravings, we have to treat those organisms that are craving it, right? And we don't want to sabotage, because that's number one on my list. Because
Okay.
even with my kids, my personal kids, all right, not just the kids I treat, if they have sugar, now mind you, I told you I have three of them. It is World War III. They are arguing, fighting. I want to give them up for adoption. And then, you would see them in public, like, oh, they're so cute and nice. Let someone have a birthday party in their school and they come home and they secretly tell me they know that that's going to cause brain inflammation and lack of focus. And the same thing holds true to my adult patient. I'm like, how are you going to focus on this protocol I put in front of you? How are we going to focus on optimizing your health? So then I might give them things like garlic or higher levels of fiber or olive leaf extract, or we try to do fermented foods, those things that give those
Mm.
good bacteria the nutrients that they need, so that we can try to eventually get your immune system up and crowd out those things like the bad yeast,
Mm.
because it is a beast and it can become disseminated and resistant. The same thing with parasites. I told you they can live outside the human host. They're hungry.
Yep.
They love sugar, right?
They love it.
So that's really the biggest thing I work on with my patients, is limiting that sugar and finding healthy alternatives. I remember I had one patient, he was on the spectrum. The
Hmm.
mom was already prepared for me. She just knew anything I told her, she was going to tell me no. And so, first of all, I asked, okay, how's sugar? My kid's a picky eater. I mean, she was ready for war. Like, I'm going to this doctor. She's going to tell me something crazy that shouldn't be, and my kid eats 4 food groups. And I said, okay, look, let's get creative. So, what we did, I said, what's his favorite cartoon character? It was Mickey Mouse. I had her make some blueberry Mickey Mouse like figures, freeze them. He ate them. And berries are some of the most calming agents that you can have in your body to calm you down. So it's all about having those alternatives. I think frozen fruits and dates for those people who are craving the sugar and eating more fiber are great alternatives. But you have to be cautious when you're giving those broad spectrum recommendations. So I have to pick my poison with patients.
Yeah.
My
Yes.
compliant patients who do the best, I tell them, you are doing excellent because you're doing all you can to remove the dyes, the seed oils, the gluten, the dairy, the sugar, the things that we know will harm your brain because you are what you eat. However,
Mm,
those that struggle, because I had a patient who was Colombian, she said, how are you going to tell me to eat gluten free? Do you know what my family's diet is like? That's unfair. You have to factor that in as a provider and be
mm,
realistic and take those baby steps. But also, doctors don't focus a lot on what to eat and how to make those alternatives. And I think that's so important and part of the journey because you can do a disservice to your
mm.
patients if you're too strict with them because not every diet is for everyone. And I
Yes.
find that some of my patients, I have a great patient, even today, he was
Hmm.
doing well, but his
Hmm.
mood, he was like, you know what, Dr. Cornish, I'm doing so much better physically, but my mood is low. And I said, why? He said, because every day I'm scared about eating something that I think
Oh man.
you would tell me not to eat. And so I feel like my angst now is about food. And I think about it when I go out. I think about it when I'm at friend's house. All I do is worry about that. And I thought to myself, I said, yes, that's keeping you in fight or flight. That's
Mm,
keeping your limbic system active. That's counterintuitive to what we want to do. So now I change my approach and I find healthy alternatives and we make strategies to get you better because we don't want diets, right?
that's
We
right.
want lifestyle changes and we want
Mm,
to be sensitive both mentally, spiritually, and culturally when we're making these recommendations because we know it works and what
yes.
we want, but we have to individually tailor it to that patient.
Wow. I think when people hear this out there, when we know that there is possibility and hope that you can affect the emotions and the mood of somebody, like help them with their angst. When you have somebody that understands, that has a doc that does look and researches, and that's what I'm thankful to hear this from you. This is really great. I'm glad you're on the podcast because there are great physicians out there that just really do care about their patients. And with this, when you talk about caring for your patient's mood, caring for their what's going on inside of their heart. What would you say to the individual who does have neuroinflammation? You've gave us great recommendations about what are some of the emotional, spiritual healing practices that you believe would help a person through this time. Yes, we can take good, some medications, we can take some herbals, we can do this. Are there anything you recommend like that for their spiritual practice or their emotional?
So, one thing I'm starting to integrate earlier in therapy is
Mm-hmm.
something called limbic retraining. And
Ooh.
there are certain programs out there, DNRS, Annie Hopper, Primal Trust, Reorigin, Gupta program.
Mm-hmm.
These programs are uniquely tailored to help a person calm down that limbic system, which is the basal ganglia, the thalamus, those areas that activate, that stress response, that make you feel wired but tired, that make you sensitive or have mast cell activation where you can't tolerate things. You're allergic, quote unquote, to everything, but it's just a sensitivity because your brain is constantly in this state of angst. But it's physical, it's limbic system. And so I found myself learning about this technique from one patient of mine who was so sensitive. I mean, she came to my office, Chris, I didn't know what to do. I tried to give her one drop. She had tick-borne diseases, a drop of a herbal, and she was like, I'm in the ER. I'm like,
Oh
wait,
my
what field
goodness.
is
Yeah.
this? And then I
Yeah.
tried something else. Can't take it. I can't go to the detergent aisle. Well, when I looked at her scan, I saw that that limbic system was active and was too
Mm,
active. And it
mm,
was triggering something called mast cells, which trigger her histamine. Your brain can't heal. So that's why I like setting that foundation of that limbic retraining and
mhm.
teaching people how to calm their own brain. And not only that, you walk through why you're not feeling well, how to
Mm.
deal with those
And
thoughts, how to change those thoughts, and how to have that positivity going forward. And it can be life changing, both to doctors, because their patients start responding to therapy,
yes,
because now they're out of what we call the cell danger response, and to patients, because they know they're not insane. It was a reason why they couldn't tolerate. They get so sad when they can't follow all your instructions. And we get
yes,
so involved because we understand the human body, and we want to treat the tick-borne, and we want to treat everything, and we want to give all the tools in our toolbox. And then patients get sad because either they can't tolerate it or they're overwhelmed by it. And that's when limbic retraining comes in. And I also tell patients, look, get sunlight and get grounded. You got
oh,
to stop stimulating that frontal lobe and that dopamine. So even if you're listening right now, turn us off after this is done and go outside or get some vitamin D and get centered, because you need that to not only calm brain inflammation,
hmm,
but just to calm the stress response, because
yes,
that is what's so important. And I tell patients a lot when they're leaving my door, I say, look, you know, I'm a pretty spiritual doctor. I try to hug patients if I can. I
hmm.
even tell some patients that I know for a while, I love them. I don't freak out all the new ones. They're like, what kind of weird doctor is that? But, like, oh, okay. But I do. There is a
Oh,
love that I have for what I do,
oh,
because it is not easy work.
yeah.
And when they leave, it's always like, okay, look, you have all these things that are wrong. Tell me one thing that's going right.
Oh man, that's good. That's good, doc. That's good.
And all patients need to do that. You might be listening, and you're listening like most patients do because they're looking for answers. They're curious about their health. They might have a loved one struggling, or they're struggling even with their mood. Okay, a lot of things are going wrong. But what one little thing are you grateful for? And
That is,
that's how you can start that healing journey, is having that gratitude and just reflecting on what you might think nothing is good,
yeah,
right? But there's something
very.
going right.
Wow, doc, that's my drop right there. I'm telling. Okay, so that's got to be a real. I'm not kidding. This is so good. So I had a friend of mine who did professional tree cutting services, and so he would come into the office, and he would always have a bad shoulder and a bad hip, but he would come in many times, and he would say, "Doc, I think I almost died today," because he would literally be swinging from a tree or something, and something would pop, and he would almost fall like many feet. And he said, I almost got, like, many times, almost smashed by a log that was swinging in the air. All that to say, he was having such bad PTSD, and he went to the Amen Clinic down in Atlanta and found that area of the brain you were talking about that area where he's like, he was completely in fight or flight. They started him on a regimen, mapped his brain, showed the divots, the areas where there were deficiencies, got him on the supplements, gave him the exercises, and 3 months later, he was saying to me, "Man, I don't know where my PTSD is anymore. It's like I'm so much better and super happy." And that's a testament to what you guys are doing for people. And that's one thing that I'm really promised about. Like, people out there, they're not stuck in that mode.
No, you are not stuck with the brain you have, right?
Yeah,
And it sounds cliche, but it's so real.
it is.
I was a neuroscience major because I'm a nerd when I was an undergrad. I'm in love. I love the brain. But one thing I learned that I didn't quite know in school, the brain is has neuroplasticity. It can heal. When you have a damaged brain, even if you have traumatic brain injury or toxins or neural inflammation,
Hmm.
you can get better. I have
Yeah.
so many, and this is when it's the most rewarding in my practice, when I have a before and after. And I show them a lot when I do presentations at
Yes.
conferences, and even with patients when like, look, you can get better. Look at this person's before and look at their after, because it can heal when we make the right changes and use the right tools that God has given us, right? It's not that
Wow.
hard for us to walk together to help find the root cause. May that be tick-borne diseases. May that be gut dysbiosis. May that mean a spiritual journey, parasites, autoimmune disease, all pans and pandas that affect kids. You can get better. I can show you, and I can give you the research that Amen Clinic has to show that it happens, right? All the time.
That's
And that's
amazing.
what's powerful.
No, this is so good. And okay, so I would love to just say here on air, just sort of like put pressure on you. I'm just kidding. To say that whenever we have times like in the future, like since you're, neurological expert, like if we ever have times in the future to like talk about concussions or anything neurological, I'd love to have you back on. If you have time, I really would appreciate it. That'd be awesome because we need people that are experts in the field, and you're highly respected. Man, I want to keep going, but I would say this: if we'll have you back if that at some point if you have time, because this is good. I would love to talk with my producer about like other questions I already have because I could keep going, but I know your time's precious. Everybody out there is wants to know. I know they would like. How could I get in contact with Dr. Eboni? How can they do? I mean, do they go to a particular website? Do you have an Instagram feed that they can go to?
Yeah, so we do at Brain Health, we do functional medicine, right? So all those disorders we mentioned, I treat, and I also treat intensively. So we've been blessed enough to have a 2-week intensive program where people can come from all over the country, sit at
Right.
Amen clinics for 2 weeks, get all their infusions, their diagnoses, get started, and get like this hand-holding approach. And we see patients just even via telemedicine. So my Instagram is at dr, so Eboni Cornish, which is my name. And then I'm at amenclinics.com, the website, and then Ebonicornish.com. So it's not hard to find me or to find other brilliant doctors at Amen Clinics, other brilliant doctors who do what I do that are members of ILADS, which is International Lyme and Associated Diseases Society. I'm not alone out there. I have a lot of brilliant counterparts, and I have doctors who are training every day to do what it is I do. And I just want to tell people, just keep that faith and keep searching, because no matter what, there is a doctor out there and thousands of us who can help, So that's how you find me, but you can also find a lot of other brilliant geniuses out there in the field of functional medicine as well. And
Wow.
I'd love to come back. We could talk about the brain all day or all night. You might have to babysit, get the producer to watch the kids for a bit if they're down, but I would love to join you again. This has
Oh,
been
no.
great.
Yeah, it's been fun. This has been a fun interview, but it's been a very insightful. I mean, I've learned a lot, and I love that people out there, I can tell when they listen to it, they're going to understand more, and they're going to see the seriousness of it, but also the hope within the conversation. So I want everybody out there, please, to go to Dr. Ebony's website, go to her Instagram feed. Please look at the work they're doing. It is amazing that the images and pictures that she has about the before and afters, it is quite remarkable. I am not just saying that. You would see shifts and changes in the brain, like literally the shape of the brain. It is amazing to me, and it'll be amazing to you. So we're going to have her back on, and Christy has her contact info, and Doc, we're going to talk all things neuro as we go along. But everybody, please check her out. If you have anybody, any loved ones, yourself, that have had Lyme disease or any infection you would suspect after this conversation, please contact her. And you guys can contact us, ask us questions. We can always lead over to her Instagram page, and we'll have all the information in the caption. So guys, remember, if you love this kind of conversation, just give us a like, or send somebody here that really needs this info. Doc, first of all, thank you so much. I really appreciate you joining us today.
And thank you for having me. This was wonderful. Thank you so much.
No, thank you so much. Guys, from all of us here, and thank you, Dr. Eboni, from the Ancient Health Podcast. Have a great day.